Welcome back to Psychedelic Therapy Frontiers, the podcast devoted to exploring the frontiers of psychedelic medicine and what it takes to cultivate a healthy mind, body, and spirit. I'm Dr. Steve Thayer, and today my co-host, Dr. Reid Robison, and I are joined by Dr. Evan Lewis. Evan is a neurologist and clinical neurophysiologist with expertise in pediatric neurology and epilepsy. Here at Numinus, he's the VP of Psychedelic Neurology and the medical director of our Toronto clinic location. Evan has extensive clinical and research experience using medical cannabis and psychedelics to treat neurological disorders in adults and children. If you'd like to learn more about Evan, you can find a link to his full bio in the show notes. Today we have a wide-ranging conversation. We talk about the potential for psychedelics to treat neurological conditions like Alzheimer's disease, traumatic brain injuries, migraines and cluster headaches, and functional seizures and other functional neurological disorders. We discuss what neuroplasticity actually means relative to what we think psychedelics do in the brain. We explore possible neurological explanations for phenomena like faith healing and conversion disorders, and of course, much, much more. A couple of announcements. The MAPS Psychedelic Science 2023 conference is coming up in June. Reid and I are going to be there. And it just so happens that Numinus is offering an exclusive 20% discount code to our PTF podcast listeners. To access this 20% off the current registration price, click the link in our show notes and use the code NWI20 at checkout. Hope to see you there. If you're interested in becoming a psychedelic therapist and want good training, click the link in our show notes to see what Numinus has to offer. If you're tired of clicking links in show notes, you can always just go directly to numinus.com/our-training-selection. If you'd like to support the show, you can do so by rating and reviewing the show in places like Apple Podcasts and Spotify. If you're watching on YouTube, you can subscribe to the Numinus YouTube channel and like the video. And of course, please share this episode with anybody you think might enjoy listening to it. Without further ado, here is our conversation with Dr. Evan Lewis. Welcome back, everybody. Reid and I are excited to be joined today by Dr. Evan Lewis. Evan, welcome.
Thanks, Steve. Appreciate it. Thanks, Reid, and happy to be here today.
Yeah, it's good to have you here.
I'm excited for this conversation. Why don't you tell our audience who you are? A little bit about you.
Sure. So, I'm a neurologist, actually a pediatric epilepsy specialist by training, and that in and of itself got me into the field of psychedelics, mainly through treatment of pediatric epilepsy with cannabis. So my training is specifically there, but I also work with adults as well as kids. I worked at a major academic center in Toronto from around 2014, 2016, and subsequent to that, opened up a clinic in Toronto to explore utilizing cannabis in pediatric epilepsy and other neurological disorders. And then, hence, as I mentioned, that led to my foray into psychedelics and exploring how psychedelics could be integrated into the field of neurology. And shortly after that is when I partnered with Numinus and came on as a vice president of neurology to determine how to utilize psychedelics in the field of neurology and try to move that needle forward with Numinus, and remain as the medical director of the clinic in Toronto here, where we treat mainly, specifically with myself, functional neurological disorder, mainly functional seizures, traumatic brain injury, mainly long-term concussion, headache and chronic migraine, and also a host of other neurological disorders. But those are the main areas where we're really focusing on rehabilitating patients and utilizing psychedelics now as one of the tools in our toolkit.
Yeah, so this is something that really fascinates me. I'm a clinical psychologist. I know a bit about the brain, but not so much from the biological standpoint, certainly not the neurological standpoint. So one of your many roles, at least the big one here at Numinus, is the vice president of psychedelic neurology. So you alluded to it in your intro, but what the hell is psychedelic neurology?
Yeah, that's a good question. I'm not so sure. I think I may have even kind of coined that myself at one point in time, and I don't know if it exists elsewhere. But it really came from my work in cannabis. I think, when I got into cannabis in kind of the early days, I found that a lot of the ways in which cannabis was being utilized in the field of neurology was coming from patients. It was coming from the grassroots type of cohort of individuals, and then kind of being thrust upon the neurologists. And I don't know, I said, you don't know much with the brain. I don't know how many other neurologists you know, but we're a bit of an interesting bunch. It's hard to convince us of things outside of what studies will show and kind of very rigorous academic type of focus. So cannabis was a real surprise, a real difficult area for neurologists to accept in general. And I think it still remains quite challenging in Canada, US, and the rest of the world. But that being said, I found that what happened was a lot of the indications for cannabis and how it was being used wasn't applied directly, or people who didn't really have a lot of understanding of neurology and neurological disease started to give cannabis to patients or prescribe cannabis to patients incorrectly. So, for example, you had practitioners who were not neurologists prescribing cannabis for really complex epilepsy cases, and you would never see that otherwise in neurology. You wouldn't have these same practitioners prescribing other anti-epileptic medications. So for me, I decided that for myself, there needed to be some ideas, and there needed to be some concepts coming from what I say, like the top down. It had to come from the doctors first, from the specialists first. And then that kind of mirror, that was a mirror for psychedelics, where I thought, before this all blows up into neurology and suddenly neurologists are now thrust with how to use psychedelics in the field of neurology by grassroots and patients, which is really important. But there's got to be this kind of meeting halfway where neurologists have a good understanding of psychedelics, given their understanding of neurology, and then learn how to integrate psychedelics into neurology. So this is what I thought overall what psychedelic neurology is. It's how psychedelics can be utilized within the field of clinical neurology.
Maybe we could chat about a few examples of that. I've seen in both the headlines and the literature over the past several years things coming out about, say, LSD for cluster headaches, or psychedelics, might they help neurodegenerative conditions, post-traumatic headache. It seems like the list of possibilities is expanding, but from your perspective as a real life neurologist and ability to digest the literature as it comes out, and with your practice experience, maybe you could summarize it a bit for us.
Yeah, in terms of the conditions that may be amenable to psychedelics.
Yeah.
So I think this is where psychedelics can be so fascinating for the neurologists who are open to the ideas of what's going on, because so much neuroscience has already been discovered about psychedelics. So it really is a wide open field for any interested neurologist. And when you start to dive into the mechanisms, start to realize that psychedelics really operate at the level of brain networks. And this is a big leap for us as neurologists, because we learn a lot about classical neurology. We learn a lot about medicines affecting particular receptors. We learn a lot about medicines having specific action at specific parts of the brain, and one part of the brain, that subserves one specific function. But the more modern view of neurology now that still has to catch up with clinical neurology is it's not the single areas of brain that we have to kind of concern ourselves with. It's how are these brain regions interacting with each other across networks, and the established network neuroscience is making its way into clinical neurology. So these are things I'm sure that has probably come up in the podcast here before, things like the default mode network and how that interacts with psychedelics. These are kind of popular science views. But this is where neurology really is at, and this is where psychedelics act at. They act at the level of brain networks. So then you just translate into, well, what conditions in neurology do we face that are primarily brain network disorders? And if we start there, then maybe there's overlap with psychedelics. So let me give you some examples of these. So this is the area of functional neurological disorders. These are brain network disorders. They affect the brain's ability to integrate and process information. Well, that doesn't happen at one part of the brain. That happens at multiple parts of the brain, all interacting with each other. Other conditions are like concussion. right? Or traumatic brain injury. These are whole brain injuries. They affect individual parts of the brain, but then they break down certain networks. Dementia, Alzheimer's disease is also another example of that. Very early, early onset dementia is really a breakdown of the default mode network. And if you start to explore the individual roles the default mode networks plays, and then you look at the pathology of Alzheimer's disease, you start to see it affects the areas of the default mode network preferentially. And this explains a lot of the symptoms we get with dementia, as an example. And then kind of other, go on and on, there's a bunch of lists here, but headache is another network disorder. So migraine very much is a network disorder. Cluster headache is very much a network disorder. So all these treatments that seem to be, or all these conditions, that seem to be emerging and people are describing anecdotally through case reports or in the public sphere, like athletes who are talking about their concussions being healed by, mushrooms and et cetera, you start to collect these disorders. They're all brain network disorders. And that's where the overlap is. And if you kind of look at it from that perspective, this is where, there's a real opportunity for neurologists to start to have a different perspective from our classical teaching, update our teaching to the more modern neuroscience view, and use psychedelics as that gateway, no pun intended here, to kind of take you down that rabbit hole and start to learn that there's so much here that we can potentially help patients with that we're otherwise haven't been able to.
Evan, is there one particular medicine / condition or combination of medicine with condition that really excites you, that's a research focus for you, or that you think has promise?
Yeah, that's the problem with all this. And as I kind of going forward is that, a lot of this work needs to be established. So I would say, psilocybin in the context of long-term concussion, that excites me. That definitely excites me. Ketamine for the treatment of functional neurological disorders and functional seizures, that excites me as well. And there's a few reasons for why I kind of picked those two. There's a mechanism point of view. There's the reports we're hearing from people. There's some personal experience we have at our clinic with some patients here. In the end, I think, though, what we need to really tease out on the neurology side is that, and what is likely going to be the case, is that I don't think it's one medicine and one condition. I think it's actually going to be a multiple type of medicine approach, i.e. different type of psychedelics and psychedelic treatments we're going to use for these particular conditions. So as for an example, a combination of maybe ketamine and psilocybin, or ketamine and LSD perhaps. And as we kind of explore this and learn more about where the overlap is between the network neuroscience and the ways in which psychedelics act on these networks, we're going to be able to determine how to use these medicines appropriately.
Yeah, that makes a lot of sense. And maybe we could dive into one or two of those. You mentioned functional neurological conditions. It'd be great to get your definition of it, because that's certainly at the intersection of our worlds in psychiatry and neurology. We in the U.S. anyway, we have the same governing board. Board certification comes from the same place, and had to do my time in residency in neurology. And in fact, Oliver Sacks was one of my big heroes while in schooling, and I love his work. But I have a special curiosity about functional seizures, pseudo seizures, you might call them. But maybe first of all, what does it mean, functional neurological conditions, and what do you mean by functional seizures?
Yeah, I mean, this is really a fascinating area of neurology, and just like you said, Reid, these are the conditions that kind of fall in that gap between neurology and psychiatry, and really that, or psychology, right? And really, that gap is such an artificial gap. It's a gap that's been created due to kind of history, our language, as well as kind of differentiating these things. But there really is no gap, right? And this is why psychedelics are so beautiful for me, is that I, as a kind of sidebar here, I really do think psychedelics are going to be the tool that reunites neurology and psychiatry in a way in which it's going to be very different and have a paradigm shift for those that are going to come up through through training in the next kind of couple decades. So coming back to your question about functional neurological disorder, it's hard to explain. There are many models to explain this, but one way to think about it, just generally, it's a problem really with processing information in the brain. So it's the brain is constantly receiving signals and constantly sending out signals to provide actions or behaviors, which is really just perception. So it's really a problem with how the brain is operating, how the brain is functioning, versus any concrete kind of structural problem in the brain that you could pinpoint to. So sometimes it's good to think about these in terms of analogy that was drawn out by a group of functional neurological disorder specialists, where they talk about the brain operating like a computer. So our nervous system is set up with its hardware, brainstem, spinal cord, all the nerves attached to all the muscles, and all the things it does. That's all hardware. So those are our hardware pieces. But then the question is, okay, you've got this great hardware. Well, how is the hardware operating, right? And that's really what functional neurological disorders are. They're a disruption in the software in the nervous system, and it's a nice model to kind of think about. And more particularly, kind of like with a hand, you open and close your hand, right? You ask somebody, how are you doing that? And they, and a good neurologist might tell you from the point of like the motor homunculus where the hand area is, and draw you a nice map all the way down to the muscles in the hand. But then it's like, well, you didn't really answer the question. It's like, how are you doing that? And you don't really know. You just do it. And so all that process, that thing that we just do and just happens for us, that's the software. And then the cool thing to learn, and I talk about patients like, with it this way, is that, we think that is just, we can just do it and that's always been there. But the truth is it hasn't always been there. A little baby, right? By the time the baby's born, they kind of are opening and closing their hand, but they're really not doing it well. But they had about, 9 months of practice prior to that. So that program is not an innate program. It's not like you just move your hand. That program is learned by the brain, and that software is developed. And actually, that software gets, updated and modified and reiterated as the baby develops. And that's why a baby cannot use a hand like an adult can use a hand with much more precision. The software is created through time. And this is what functional neurological disorders are, again, coming back to it. It's disruptions in the software programs in our nervous system.
Cool. So let's look at, say, a couple examples. I remember in the past when I was working on a psych unit, I had a patient come in admitted with functional blindness. I've encountered this multiple times. I've had a lot of, it's a slightly different mechanism, but a lot of patients with catatonic schizophrenia on psych units. But there was one memorable one of, I set up a psych consult service, psychosomatic medicine team at a hospital here in Utah about a decade ago. And I remember we had one young adult or late adolescent gal life flighted in because the seizure was so scary to the team where she lived, and it was found to be a non-epileptic seizure. And it was really a memorable case because a lot of the time it's troubling to people to get this diagnosis, because it does not mean that the patient is imagining or inventing it, right? It means that like you said, it's a software program issue. It's a psychosomatic or somatoform issue where the symptoms that may have had their root in trauma or stress are manifesting in the body, just like when we get embarrassed, we blush or something like that, or stress-based illness make medical conditions worse or even cause them. But maybe functional seizures would be a fun little tangent to go on from your perspective.
Sure. And just right before I come back to your functional blindness, right? So because this is actually really neat. The fact that we see anything is also a program, right? That is not something innate. It's also a program. And if you want to access that program, just close your eyes and imagine an apple. And there you go, right? There's no apple at all, but you have consciously access that model in your mind that has an apple. Now, it doesn't look like an apple in real life. Or real life, or something that's out there in the world. But more or less, you can have a representation of that apple in your brain. You access it right there. And there's actually people who can't do that. They have an inability to picture objects in their mind. They have it, and they actually can't do that. So there's somebody who doesn't have, that program well developed, right? So these things exist. So if you can access that program, build that up, can something happen to you that can break that program down such that you see nothing, right? And this is the disruption of software, and that might be the person who has functional blindness.
Right? You know what struck me once was, I think it was like a 2016 study. David Nutt in the UK, Carhart Harris, they gave IV LSD, like 75 micrograms, to people, to volunteers, and put them in a scanner. And with eyes closed, the areas of the brain lit up as if they were seen, like their visual systems were not stimulated by the outside world like, they would be normal open eye life. But under the influence of LSD, those areas were not only active in the visual sense, but the pathways that connected them to hearing, attention, movement were on board on this medicine, kind of seen with eyes closed in a way.
Yeah, I mean, this is where it gets really, really neat, right? So in a psychedelic experience, what do people report visually, especially with LSD? LSD has a particular type of, degree of this. These are these geometric patterns that you see. It's like, what are those, right? Those are the models in our brain makes of the world. Those are the most base models our brain stores in itself. That is the fundamental concepts we have around vision, right? And that's why they tend to be very geometric in orientation. They're colorful. Your brain is storing all that information. It's almost like you have access to what your brain is always doing. It's always there in the background, kind of doing this. And this is something we'll probably get into that's really important, is your brain works as a master of predictions. It's constantly making predictions, and then it meets the outside world and it verifies those predictions, and that's what gives us our perception of the world. So it's almost like your brain always has this very base geometric stuff that's going on at all times, and it's kind of searching out into the world, trying to make matches, which gives you the formulation of whatever it is you see, whether it's a water bottle or a glass or a human face. It's kind of doing it, but underlying all that, it has to build, the image of a face up. Then underneath all of it is just shapes and lines first before it's anything else. So under the influence of psychedelics, this is what you're actually perceiving. You have conscious access of this because the predictions are all breaking down and you're kind of left with the most base predictions. And then we see this in that study. I know which one you're talking about. And you can actually see that the brain is doing this. The predictions are broken down so much that what you have left over is the most fundamental models, visual models your brain has stored in that software in the brain. And as a subjective experience, you have access, conscious access to this, which you don't, because when we're kind of fully in consciousness, because all of our predictions are built up in such a way that those shapes have a more complex nature to them to formulate a water bottle or a face or something, as I mentioned before. So this is why it's so fascinating. And then you see that in the brain too. And then the other piece,
super cool.
Yeah, and then the other piece about the come back to functional blindness. So again, if you can kind of, right, we said, if we can build all this stuff up, you can take it down. So if the software stops working for whatever reasons, and there's a lot of reasons before that, then yeah, you might see nothing. Your experience of vision might be nothing, or some weird kind of interpretation of nothing. And this is not new. Herodotus describes in the Battle of Marathon, I forget the character he talks about, but he's describing the Battle of Marathon, and he's describing the battle being really violent and everything. And then suddenly one of the soldiers is stricken with blindness, with no wound, or something like that. Yeah, and this is not new. We've known about these types of conditions for a really long time. And Band of Brothers is another example of this. Band of Brothers was a great show. It was made about World War II, and this is about I think the 101st Airborne, and these are true stories. And one of the scenes, one of the soldiers is stricken with functional blindness right after one of the big battles, and he's blind for a couple of days or a day or so, and then he's just magically kind of, his vision restores. So there's something about stress that overloads the system of the brain that doesn't allow these software programs to run appropriately. And the experience of this is an alteration in perception. So there's some energy shift that occurs that doesn't allow perception to fully form itself. And the experience of it is, it can be very particular, like blindness. It can be very particular, like an arm that doesn't work. It can be very particular, like an episode where your brain turns you off, transports you to the future. And this is a dissociative episode. It could be something like that as well. And that's kind of what functional seizures are.
Go ahead, Steve.
Sorry. Yeah, this makes me think of a possible neurological explanation for faith healings. Like if you choose not to believe that God has intervened and all of a sudden given this person the ability to walk again or the ability to see again, is it possible that something happens in a faith healing context, the support of community, the intense belief that they can get better, that maybe, where if I severed your optic nerve, maybe, intense belief isn't going to restore your sight. But if you have a functional blindness, that might just be enough. And maybe that's kind of what we're doing with psychedelics. It made me think of the placebo effect. And it also made me think of why, when you were discussing the geometric patterns that psychedelics give us access to, being sort of the building blocks of conscious thought or conscious perception. These cognitive heuristics, these shortcuts that the reducing valve of our brain gives us to sort of function in the world are a double-edged sword. Sometimes they just help us, as I stated, function in the world. But if those shortcuts or those heuristics are dysfunctional, if I'm filtering everything through a belief that I'm worthless, for example, breaking down all the way to the building blocks of consciousness with something like a psychedelic might help a person where they haven't been able to do so in the past reconstruct a belief. Just from a psychologist perspective, it's really interesting for me to hear you talk about from this neurological perspective what psychedelics are doing.
So there's such amazing tangents on that, Steve. So first off, the faith healing. So this is cool. This is a real area that I've been like just recently kind of digging down, is all Griffith's research on mystical experiences, right? So when you start to look at all the work of mystical experiences and what mystical experiences can invite. So these can be can be occasioned by experiences in nature with animals, flow states, through sports, through long distance sports, through other kind of very personal experiences like sex can do this as well. And then there's all hosts of things, including religious types of experiences that can occasion these mystical experiences. And these mystical experiences have very core features. And one of them is unity, and this feeling of unity. Well, psychedelics, from Griffith's research, also occasion mystical experiences, and they give this core feature of unity, which is really mapped onto ego dissolution. So this is where you can, if you can experience these things via the religious route and experience them by the psychedelic route, we are kind of doing the same thing. And this is, I didn't think about it in terms of faith healing, but that makes that you just kind of reconciled faith healing for me to some degree. So that's really, certainly I think it's probably one mechanism why that's working. And then the last thing I'll just touch on is the shortcuts you're mentioning. And the shortcuts, this comes back to the predictive brain. The brain is its master scientist in a box, and it's just trying to figure out what's out there in the world. And it, over time, it learns these things and learns and relearns and relearns, and through its catalog of experiences, is always then making its best prediction. Well, the best way for us to operate in the world is us to have the shortest route to understand that this container has water, and water gives us water. We need water. So if you have the best, most best predictive mechanism to identify something, well, you want that. The brain wants this, and this is what the brain does. The problem is, though, when that becomes too good, when it becomes if the brain's predictions are too successful, and this is the hyper predictive brain or the over predicting brain, and this is where you run into problems, and that translates into things like depression, things like PTSD, things like anxiety, things that are over predictive. And if your brain's making too many predictions, it gets stuck and rigid. And these are the rigid brain networks that psychedelics works to counter. So yeah, those are two great points. I can offer a lot of different ways with these.
Speaking of faith healing, there was a famous neurologist, Jean-Marie Charcot, who, this is like in the 1800s, wrote an essay. I don't know if you've ever read it, but it's really cool to look back on, an essay on faith healing, just trying to describe, why this happens from his perspective at this time, with that understanding, pre-psychedelics in our culture in the same way it is now, about why people might start to walk when a faith healer says walk. It's really cool.
Mm-hmm. Yeah, and in the end, these descriptions through time, and it's, there's a lot of descriptions in Greek literature, Roman literature, even medieval period, and because there's a lot of horrible things that humans have done through war in that time, so it tends to be a lot of these descriptions come out, and you see this stuff through time. So, coming kind of back to the functional neurological disorders, these are not new. And that was, subsequently then kind of classified and given a mechanism by Freud, and this is what is termed conversion disorders. So what we've known in the kind of psychiatric literature is of conversion disorder. Freud's theory was one in which, deep-seated kind of subconscious emotion gets converted into physical symptoms. So, that was kind of a base theory. It's one of the building blocks of the current theories for functional neurological disorders. It doesn't explain everything, but there is this kind of, quote, conversion from I like to think about it literally as energy, because it is electrical energy in the brain, and certain states the brain can reach that are energetically favorable or not, depending on the mechanics of the brain. And so you have this, deep-seated kind of emotion that comes with the brain entering into a certain high energy state. The brain doesn't like high energy states. The brain is always trying to find the lowest possible energy state at all times. So it has to dispel, this kind of energy into other ways. And it does that often by producing physical symptoms. So a nice real example, and this is so clear. This is something that really, I think, sometimes can help a lot of people understand. You have to imagine a scenario like this. You're driving in your car, and this actually happened to me. And this was actually a big, light bulb moment for me that, that helped me kind of explain this. You're driving in a car. I was actually parked at a red light. Light turns green. I go out into the intersection, and someone on the other side comes. They blew through their red light, right? Going really fast. I turned at the last second, and they missed me by an inch. Right? And that car was going to come at me right at my door. I turned the car over, put on the brakes, and I'm shaking. And then in that moment, even though I was scared what happened, I started to think about the brain, and I was like, oh my God, nothing happened to me, but I'm shaking, right? We take that for granted. Like if I tell that story to anybody, like, oh yeah, you're probably shaking. And we don't even think that that's weird, but actually nothing happened to me whatsoever, except for a very quick moment, my brain was thrust. It went from, very relaxed, low energetic state to a significantly high sympathetic overdrive, where my brain kind of wired itself into a way that was highly energetic, and then it stopped almost immediately. So my brain was so full of energy, it had to decompress that energy. So it decompressed it and sent it out to all the neurons that control the muscles in my body, and I was shaking the energy out of my body. And this is how the emotion, the fear, translated directly into a physical symptom. And that can really, and so if it can happen and we just take that for granted, imagine in all the other circumstances of sympathetic system kind of being, overdriven, or fear, other emotions, how that can translate into physical symptoms. And then it all makes sense why this stuff happens all the time. Yeah.
That reminds me of, it was in that Jean-Marie Charcot essay, or another one of his cases he presented way back then, was some girl with a contracture of her leg, like a teen girl. And he talks about the ability of moral shock to elicit a cure sometimes. And I think this girl was accused of stealing, and it was such a nervous system event that she could relax that leg, use it again, resume her dance, and went on to like be a Moulin Rouge performer or something crazy like that. But a moral shock in either direction, an event.
I think we should add moral shock therapy to our list of therapies that we offer here at Numinus. A little bit different than electroshock therapy.
Yeah. With a little bit of faith healing as well.
There you
Seems
go.
like we could do that. Yeah.
Here's another slightly related tangential question about that study that came out a few years ago saying psychedelic users appeared to have some improvement in their color blindness. I don't know if either of you saw that, but it was based on like mostly psilocybin, LSD, and the theory was that these connections the pathways are lit up and therefore strengthened, and that's why someone's color blindness went from bad to not so bad.
Yeah, I don't think I saw that, and I'd be hesitant to kind of talk too much of that because there's such an area of neuro-ophthalmology that's so specific. I wouldn't want to kind of put my foot in my mouth here, but it does remind me. There's another study from the 60s, I think, that talks about color as well in LSD. This is also an interesting one, and it probably translated a bit here, Reid, because I could posit some ideas about why that would be the case. In that study, if I'm remembering it correctly, they had users identify palettes of different greens, for instance. It may have been out of the shades of the same color. And they did it not on LSD, and people were able to identify it to some degree. And then on LSD, there was less color discrimination, right? So that makes a lot of sense. Again, color doesn't exist. Color is a creation of our mind. There's no such thing as color in the world, and that is due to predictions. And so, when not on LSD, when your brain networks are intact and functioning and have a certain state to them, you're able to discriminate and order things very well. Then on LSD, as it breaks down your predictions and kind of integrates the networks in your brain, you're not able to order things as much. So you're not able to discriminate colors. So what I've always thought as an application for psychedelics is people who have visual perceptive issues due to TBI, and this is where I'm not sure if color blindness overlaps, is you can use something like psychedelic assisted vision therapy to help people who have perceptual visual disorders, right? So you can kind of break down the green discrimination, and then with proper vision therapy, as the psychedelic kind of wears off and the brain's in a cognitively flexible state, you can reteach people how to order color properly as the brain networks kind of come back online. And we see this a lot in people who have long-term concussion problems. They have a lot of visual disturbances, and that's due to kind of too rigid of brain networks that you need to kind of go in there and make these kind of the networks break down a little bit in order to reorder them and come back up. So is that possible? It might relate to the color blindness piece, but I don't want to get too much into the details.
Yeah,
that might be
that makes
not
sense.
Translating correctly. Yeah.
Even the other day, we dosed a group of 6 people in this program we're doing with ketamine, and coming out of them, one participant just kept saying how his vision felt different, or that's a known phenomenon in a different way with like MDMA and some of the the muscles that control eye movement. But it's just always fascinated me what a psychedelic, especially classic psychedelic, can do to induce a hallucination or cause a perceptual change in the world from a neuroscience standpoint, especially as we start to understand it more, like the fact that classic psychedelics can turn on an inhibitory interneuron that will hit this area, this concept called end stopping, like the shorter lines of what we see or the edges of things get kind of wiped out, but not the things themselves. So we see a waviness, we see a blurry edge, a trail, a halo. We're starting to get explanations for these fascinating phenomena that we see on psychedelics,
So this is like coming way, a bit full circle back to the very beginning, Steve, when you asked me like what's psychedelic neurology. So here's a perfect example, Reid, right? Like if we can get kind of like the best neuro ophthalmologists in the world, so who are super subspecialized in this area, teach them all about psychedelics. Imagine how much faster we'll learn about this stuff. And this is why I kind of say to neurologists, like that's psychedelic neurology. Like it's that famous Stanislav Grof quote, how he talks about how psychedelics are to psychiatry as the microscope was to biology and the telescope was to astronomy.
Yep.
This is it. It's the same. It's as it is for psychiatry, it also is for neurology. Like as much as psychedelics are this really interesting therapeutic tool, they're also an investigational tool into helping us understand the brain. But we need the right minds who have the base fundamental understanding of that to be the ones to come in. And that, like for me, for instance, I'm an epilepsy specialist. So, it makes sense for me to try to explore this in the context of disorders that, that affect epilepsy or connected to epilepsy. And that's where the functional seizure piece comes in as an example. And that's why I'm really focused there.
Yeah.
Yeah.
You might need to give the neurology specialists some psychedelics as well to experiment to get them on board. But
Yeah.
What's funny is the first trip Oliver Sacks ever had or tried to have, he was like a late bloomer like myself in terms of experiencing these things. He was in his 30s in like residency or something, and he and a friend ordered 50 micrograms of LSD to share. And so they're all excited and they each take 25 micrograms and they feel nothing.
Right.
We should have gotten 500.
And then got on a bicycle. That would have been a good follow-up story.
So, Evan, I have a question for you. I've been meaning to ask a neurologist, but I think it's especially for a psychedelic neurologist. In sort of popular psychology, or I guess popular neurology vernacular, you'll hear a lot of people talk about neuroplasticity or synaptogenesis or neurogenesis. And so people are like, yeah, psychedelics help with brain disorders or mood disorders because they make the brain more neuroplastic. And I've even seen some studies, placebo studies where they show nerve cells after psychedelic exposure, and there are more dendrites, like there are more branches. It's my understanding that a lot of drugs will do that. That neuroplasticity maybe isn't as sexy as a term as we want to think it is. I was listening to Gul Dolan's interview on Tim Ferriss's podcast, and she was talking about how neuroplastic heroin makes the brain, for example. So what's your take on this notion of neuroplasticity, synaptogenesis, neurogenesis? Is it really what's going on that's exciting about psychedelics, or is it something else?
Yeah, it's a great question. I think, like, just to kind of preface this, it is a massive area that needs to be explored further, and it is being teased out. So I think one first big kind of misconception is out there is that neuroplasticity means the building of new connections, right? And that is a bit new. There's a bit of a nuance there that is important. It's actually what you don't want. Like, you don't want new connections, right? So new connections in the brain is like a bad neuronal brain tumor, right? That'll create a lot of new connections. That's a very neuroplastic type of ball of cells that are creating a bunch of new connections. You don't want that. Epilepsy happens when we have new connections. We get aberrant connections that shouldn't be connected. So this is the big thing with the neuroplastic changes that we're seeing with psychedelics. It's not necessarily building new connections. It's about reestablishing dormant connections or reestablishing, pathways that are underused and underutilized. So what's happening is there when you put the brain into this state of neuroplasticity, what it means is it has an ability to form connections. And so what you want is you want to form connections in pathways that are being underused, because presumably in a condition like depression, there's rigidity of certain connections and certain pathways, and they're just being overused and really strong and strengthened. And you have these other connections that could potentially be developed that would provide resilience to the self-ruminating thoughts and everything else. And you want to strengthen those. And so you want to create a state of neuroplasticity in which you can strengthen and reinforce the underused connections. So it's almost like a restructuring. So that's kind of one big kind of nuance to kind of reconsider that. And then that kind of helps a little bit of understanding. So what neuroplasticity really is a state. So yes, psychedelics do cause neuroplasticity. They create kind of molecular sequences and pathways that or molecular steps that result in the release of certain molecules that put the brain into the state of its ability to form these strengthened connections between neurons. So then the question is, all right, well, yeah, other drugs can do that. So is that advantageous? It's certainly advantageous if you can help to promote the neuroplasticity in down the right routes. And this is where, psychedelics on their own, right, won't do much for you if you don't have the proper support and the proper framework. So it's more about the way in which we approach psychedelics and this is my understanding, it's the way we've approached psychedelics, that this is bookended with therapy, that this is using therapy to modulate this neuroplastic state to help facilitate restructuring and reinforcement of pathways in the right direction. And we know that when can patients be harmed? Well, they can be harmed when those that go off and do a psychedelic trip on their own in a bad setting with a poor set and don't do anything about it, right? You actually can get negative experiences. So you put the brain into this state where it's flexible and can reinforce underused pathways. But what you could do if you're not facilitating this correctly with the proper external supports, you can actually put yourself in a worse situation. Or the other way to think about this is you put somebody under psychedelics, it creates this neuroplastic type of state. And then all of these insights come out because, well, first off, you break down the networks and this kind of breaks down your predictions. You have all these insights. The insights then permit you to now access these new pathways, but you got to reinforce them. And the neuroplasticity that comes thereafter, this is what we want to reinforce. Okay, but then you go to work on Monday and you don't think about your psychedelic experience. You don't follow up with your therapist, right? Nothing. You have all this insight, but nothing happens. And in real life, this happens too, right? If you get a great insight, not in a psychedelic state, and then do nothing about it, well, that insight just kind of goes away and dies. It's like, inaction is like the deathbed of insight. It's kind of is what I say. So presumably then other drugs that are doing this, I think it's more of the way in which these drugs are used clinically. So can the SSRIs promote neuroplasticity? They can, right? There's a degree of what they can do there. But how many practitioners are giving people SSRIs and putting them through a very structured therapy program, right? Really not many, right? It's more of this model of here, take this SSRI and you're going to feel better. Come back and see me in 3 months. So I think a lot, Steve, has to do with the model of psychedelics. And then there is some mechanistic concepts here, right? Like it clearly is a very powerful action, psychedelics. It gives you conscious access to a state in which your predictions have been broken down. So there's a bit of a conscious kind of perception that's going on there that's allowing one to they themselves facilitate this growth in the right direction. But I think coming back full circle, just to kind of summarize this, I think it's the model in which we are utilizing psychedelics, in which we are it's putting people into these neuroplastic state, and then we're facilitating growth in the right direction. And I think ultimately, when studies are done that are able to look at this and compare people who would just do small doses of psychedelics and don't have the proper therapeutic supports, they're going to do much more poorly than those who have the therapeutic supports. And that's why I'm a strong advocate for the assisted therapy model and not so much the other way.
It also highlights the need to be careful with this window of opportunity or neuroplasticity, given how vulnerable and malleable it is. Be careful as an individual pre and post psychedelic experience, especially after, knowing how vulnerable things are, and be careful as clinicians with, making sure people are safe and protected and not harmed or shaped in the wrong directions. I like the way Gould Dolan talks about it as critical periods, like psychedelics remove the brakes that we get during adult development on the rapid learning, that hinder our adult neuroplasticity. And whether it's a period of critical social learning, or not, removing the brakes of that makes us open to those things. But then you have to be careful what gets imprinted on you during that period. It reminds me of like this old Timothy Leary talk I heard from the 60s, where he went kind of wild on some of these theories of imprinting, and it's fascinating, citing some research where they'd take little ducklings at a formative young age and try and imprint them to, instead of a mother duck, a basketball. And then you have these little ducks following along a basketball or something like that. Or this researcher was known for just having like a harem of ducks follow him around because he was researching them so much in these sensitive periods. But it does highlight the importance of using these things wisely.
Yeah. Yeah. And I think that's a great point with the imprinting. And I think that comes back to that window of opportunity and how to use it successfully and optimally.
Yeah, and so use it safely, successfully, optimally. It's also, I think, why some people get really abused by bad actors in some psychedelic contexts, because, like the two of you were saying, you become vulnerable and susceptible to suggestion, especially if you're on a cocktail of medicines, something like MDMA with psilocybin or LSD, and that can be really powerful if held in the right container with the right people with the right intentions. But it can also be very damaging, and you see people taken advantage of, or you see, psychedelic use in some cults, infamously, or the government trying to use LSD as a mind control agent, right? With MK Ultra programs. So, yeah, these neuroplastic windows can be used for good or for evil.
Mm-hmm.
And we see that clinically, like the same adverse experience that happens at a certain stage of development, like a vulnerable one during childhood has a greater chance in general to affect lifelong psychological functioning than experiencing that same thing, 20 years later, where that window, that critical period, that neuroplasticity isn't as open, and not to discount the terrible traumas that have an immense impact in adulthood, because they do. But there is, as we all know, there's something very vulnerable about childhood that you can liken some of these psychedelic states to.
Yeah, and one advantage, I think, and this is where coming back again to psychedelic neurology and psychedelic pediatric neurologists. I mean, that sounds like a wild idea, but I mean, pediatric neurologists. I mean, we're the people who understand brain development quite well, and this is again an understanding of psychedelics, an understanding of pediatric brain development. There's massive overlap. When you are born and your brain is a fresh brain that's come out of the womb, this brain is totally interconnected, right? And the experience of the world is very much a sensory experience, and the brain is just beginning to account and take in all this information and create its spreadsheets of all the information in order to form its predictions. And what happens to the brain through time? Well, the brain is this massive interconnected blob, and it grows, it gets bigger, but it starts to prune itself, and cells die down, and the networks form. And the networks are, that is analogous to the predictions. And this is what happens. So when you look at pediatric brain development up into adulthood, you're born with a very psychedelic brain. It has no predictions at all. So much so that, if either of us transported ourselves into our 8-year-old brain, you would not be able to recognize the world. you would perceive the world in a way that would be completely different to what you know of the world right now. We believe that we perceive the world exactly the same way, but you have no idea how to know that. You're one continuous stream of consciousness, and it just kind of there was just a slow change that happened over time to what you think is a stable reality, but not at all. If you go back there, the world would be kind of moving and wavy, and things would be really colorful. And we know this is the behavior of children too, right? If you look at how they behave, how they see wonder in so many things, our brain just has gotten used to it over time. These old predictions, we don't care about that much anymore. The world's not such a great place. So, and then you can mirror that with how the brain actually develops. And we know that because, networks like the default mode network are not well established in young kids, and they get established over time if you follow them and see. So this is where it's such an awesome area of study for neurologists if they'd open their eyes to it. As I said, I think I've already said that in this talk, but I'm emphatic about it.
Oh, it's amazing. I've heard it called, what you're describing, lantern consciousness as kids versus spotlight consciousness later in life, as we prune, as we get blinders on, as we stop seeing the wonder and the magic in things. And we've also talked about it on here a bit. If you want to know what it's like to have a psychedelic experience, just have a tea party with a 4-year-old, and you'll see it's quite beautiful.
Yeah, being a baby must be super trippy. I didn't really thought about that from that perspective, but also as a parent, what you just said, Evan, it evokes compassion for me as a father for my young kids who are freaking out about stuff that seems inconsequential to us as adults.
Yeah,
we have perspective, we have experience, but also we are literally perceiving the world differently, like literally. So if your kid's freaking out because their balloon popped, and you're like, I'll just inflate another balloon, have some compassion, because their brains function very differently.
Everything is different. And it's not just again, when we say perception, we liken it almost to visual perception or emotions, because that's easy, but it's everything. I mean, even movement is different. This is why, and the movement is based on predictions. It's based on your brain's ability to predict. This is why a little baby doesn't move, and the little baby actually doesn't have the software program that it's developed to walk until 12 to 18 months. But this is why kids knock things over all the time. There's software that predicts their ability to move their body is still being developed, and they're just clumsy, and they're knocking things over and everything. So the same kind of compassion, right? It's we think, we know a child knocks something over and it's because they're a kid, but what does that actually mean? Well, if you have a true understanding of this, they actually don't move their arm anywhere near the same way we move our arm. If you, again, transport yourself into that little baby's brain, you'd have no control of your arm. You wouldn't even, this thing would be flopping all over, and it wouldn't be the same as right now. You'd have, so it's everything. And this is where it's so neat. And really psychedelics helped me understand a lot more about brain development, than anything that I was taught growing up. But it came on a foundation of all the things I was taught, so it's hard to separate those two.
I'm glad you're bringing up the body here, because that's an important, sometimes overlooked one. Of we accumulate patterns over time as these prediction machines, including patterns of how we move. We are what we repeatedly do, and a little kid can do the splits almost universally, but they might be clumsier on picking up a fork or pouring some milk, because these patterns also get stuck in their ruts, and because of what we repeatedly do. I see it in my kids, and it argues for both kind of emotionally, physically in movement, intellectually, just having a variety of experiences, a wide range of ways you move and explore the world, especially, not only in childhood, but for grown-ups too, just to remember to play and explore and move the body outside of the ruts we get stuck in.
Yeah, novelty is so important. That's also another area that I'm really fascinated is the idea of novelty and how important that is to the brain. And again, kind of informed by psychedelics and psychedelic neuroscience is how important, how novelty really can help with cognitive flexibility, and that's where the idea of play often comes in, because play is, it's unpredictable, it's chaotic, it's not similar, and this is where play is really important in terms of kind of developing a healthy adult brain and not getting stuck in your way. So, novelty play is one way to express novelty or experience novelty.
Yeah, so is acid, right? It's a very a very novel phenomenological experience. I think, if there's a future time when I'm on a psychedelic, I might try to transport myself back to my 8-year-old self and just kind of see how that goes, and do some playing. Well, Evan, we're coming up on an hour. Is there anything that we haven't covered that you want to talk about?
One thing, because we kind of got, maybe I'll just, for people listening, kind of give a more concrete example clinically about what the effects of psychedelics can do in neurology. I'll take it back to functional seizures. We really get into the details of kind of, what they are, but, more or less they look a lot like epileptic seizures. Epileptic seizures are due to electrical abnormalities in the brain. Functional seizures, as I mentioned, it's a lot to do with the software not working properly, and can be thought of as a very sensitized response to stress that happens over time. Really complicated. It's kind of way outside our chat now to kind of go into the details, but to say the least, it's a problem with brain network function, and we know that from some pretty good neuroscience and some modeling that's been done for functional seizures. So me and my team, we posited that for a while that psychedelics could work, particularly ketamine, given some of its mechanisms of action. And one of our first patients that came through the clinic here, who had a really complicated history. So just to give you a bit of background, she was suffering from functional seizures for 5 years, on top of a really challenging history leading up to that. But 2 to 3 seizures a day, sometimes seizures lasting over an hour, totally incapacitated. She would be bedridden, wasn't able to work, wasn't able to take care of her kids. Obviously this impacted her significantly from a mental health point of view. A lot of other problems too, with suicide, etc. And we brought her through the program. She didn't have many options. She multiple different treatments. She was at that point addicted to benzodiazepines, because what happens a lot with these patients is they get treated like epileptic seizures and are given medications, and there's a lot of anxiety that comes with it. So benzodiazepine dependence, it happens a lot. So a whole host of factors that were working against her. We put her through our ketamine-assisted therapy program, and after having, again, 2 to 3 seizures every day for 5 years, after her third ketamine session, she went seizure-free for 9 days. And we continued with therapy. We continued with some periodic maintenance ketamine. Now it's been, I think, close to eight months, maybe 9 months. And she's now having about 4 mild seizures a month, many of which she can stop on her own. Fully back to work. Depression scores are all normalized. Her functional scores or functional ability scores are normal. She's taking care of the kids back when it is literally a life-changing story for this woman. And this is a population that is highly treatment resistant. Most therapy doesn't work. Medications certainly don't work. And therapy is very challenging. And these people have a ton of disability. And again, as I mentioned at the very beginning of the talk, they fall in between this abyss between neurology and psychiatry, because the neurologists don't have much that they can do after not diagnosing them with epileptic seizures, and the psychiatrists, their hands are tied using medication that doesn't work. So this is a real big step forward for our program here, and something we're going to continue to explore and are really excited about, because this is potentially a treatment option for somebody. And we've written this up in a paper. It's kind of being reviewed right now, and will be the first ever case report for the treatment of functional seizures with a psychedelic, and specifically ketamine.
That's amazing. I'm excited about that, the potential there, and well, glad to be your colleague and friend in this endeavor. It's an exciting time, and we need more neuroscience and neurology in the mix. That's becoming more and more clear.
Absolutely. Yeah, same here. The sentiments, same, Reid. And Steve, pleasure to chat with you as well. I appreciate it, guys.
Yeah, I think our audience is going to gobble this up. Our other episodes about neuroscience and neuropsychology, neurology do very well. So I'm excited.
Great.
I'm excited to share this conversation with everybody. So thanks again, Evan.
Yeah, thanks for your time.
All right, you as well, gentlemen.
Bye.
Psychedelic Therapy Frontiers is brought to you by Numinus, a mental wellness company committed to tackling the global mental health crisis by delivering best-in-class psychedelic-assisted therapies, contributing to the body of primary and clinical psychedelic research, and fostering healing through community connection and social responsibility. You can learn more about Numinus at numinus.com. That's Numinus.com. If you enjoyed the show today and you want to support us, here's how you do it. Rate and review the show on platforms like Apple Podcasts and Spotify. Subscribe to the Numinus YouTube channel, like the videos, and share it. Share the show or clips of the show with someone that you think will enjoy it. The content of this podcast does not constitute medical advice or mental health treatment. Consult with a medical or mental health professional if you believe you are in need of mental health treatment.